Tangible versus intangible. Question was posed. Have you ever encountered a situation where cultural practices affected someone's health related decisions or attitudes toward medical treatment? The answer is yes, I have. I've found that to be true in dealing with religious traditions, interpretations of scripture versus traditional or clinical based medical treatment. In this, I found that in some traditions, some religious organizations such as Jehovah's Witnesses, their religious opposition to blood transfusions has posed problems when it comes to treatment or blood or life-saving situations. Their interpretation of biblical scripture, they refuse transfusions even in life-threatening situations based upon their interpretation of scripture found in Genesis chapter 9 verse 4 or Leviticus chapter 17 verses 10 through 14, and even in the New Testament Acts chapter 15 verse 28 through 29. Their interpretation of God's command is to abstain from blood as prohibiting its medical use. They view blood as a direct representation of life and that it's sacred to God. In this, they view that blood represents, or God views blood as a symbol of life, which belongs only to Him. And because life belongs to God, then the blood is sacred and it must be treated with reverence. And so the witnesses, Jehovah's Witnesses, believe that receiving blood transfusion is like eating blood, which violates God's command, even if it's given intravenously. Well, in this, it creates a significant and ethical and medical challenge for healthcare providers. What do they do in situations like this when religious practices prohibit them from giving life-saving things to patients? So that's a big issue. And the mistake in these situations is when you just opt for this traditional or faith-based remedies without even looking at the scientific or medical evidence and advice from medical professionals. And this can often occur for several reasons. First, individuals may deeply trust cultural knowledge passed down through generations, and they view it as safer or more morally acceptable than modern medicine. Secondly, historical mistreatment of marginalized communities by medical institutions has created lasting mistrust. Some patients are hesitant to follow the commands because they feel like healthcare workers, doctors, lawyers are only trying to get over or make more money. They're giving them things that they don't necessarily need in order to get more money, in a sense, I guess. According to Kleinman's theory of explanatory models, patients and healthcare providers often have different understandings of illness, its causes, and appropriate treatments, which can lead to miscommunication and non-compliance if not addressed. In other words, they're guessing. And because there's a varying difference in treatment, patients tend to be a little skeptical on taking medicine or blood transfusions. How do we fix this? Well, some ways that Jehovah's Witnesses or patients who have these spiritual beliefs, they can allow for healthcare providers to explore bloodless surgery techniques or volume expanders or other medically accepted alternatives that align with the patient's belief while still reducing the health risk. According to the World Health Organization, WHO, they emphasize that traditional medicine can play a supportive role in healthcare when it is used safely and alongside scientifically validated treatments. I found out in research that perhaps maybe that artificial blood could possibly be a way of bridging the gap. It's artificial blood is made, or it's to act as a substitute for red blood cells. While true blood serves many different functions, artificial blood is designed for the sole purpose of transporting oxygen and carbon dioxide through the body. And depending on the type of artificial blood, it can be produced in different ways using synthetic production, chemical isolation, and biochemical technology. I found this very interesting, to say the least. I don't know if they would view that as being an abomination. I don't know. But if they view life in the blood, then maybe artificial blood would be an alternative. And if they'll view it as if you were having an artificial limb or something like that. So it's very interesting. But in this, the conflict between cultural beliefs and modern healthcare practices, they're complex and probably not solvable at this moment. Mistakes can often occur where one system of knowledge is treated as superior to the other. I believe in God and I believe in the power of healing, but I also believe that God works through medicine as well. I believe he gave man the knowledge to be able to create certain medicines. And so I trust God in the sense that he'll send the right person and give me the right things that I'm supposed to take. But that's just me. That's no reflection on anybody's cultural beliefs concerning this. That's just my own perspective. But the question that I have at the end of this is, how can healthcare professionals be better trained to navigate these type of situations where cultural and religious belief conflict with each other? How do they fix it? So that's my question. Thank you.